This is the lecture on eating disorders. Contributing factors of eating disorders include things like culture, usually Caucasian Americans, with beliefs about physical beauty and that influences their self-esteem and sets the standard for beauty. Biology includes genes that cause poor affect and impulse control, and chemicals in the brain such as altered serotonin. Another factor is family. More susceptible with a first-degree relative with bulimia or a family member that overstresses the importance of body image. And then psychological, emotional issues. This includes low self-esteem, depression, anxiety, and mood or personality disorders. Stress is a physical, emotional, or psychological demand that can overwhelm the ability to cope and lead to health problems. Stress is caused by stressors. Stressors are psychological or physical stimuli that are incompatible with current functioning and require adaptation. Emotional stress, such as loss of a loved one, failed relationship, work and school stress, or sexual abuse may be a trigger. Such emotions may disrupt brain chemistry, such as serotonin levels, that help control mood and impulses. Increased stress may occur due to cultural or societal influences to be thin or an increased need to be perfect. Difficulty controlling emotions may lead to individuals finding comfort in this inappropriate mechanism of control or coping. Stress can cause anxiety. Anxiety is known to contribute to eating disorders. Anxiety can make symptoms worse and slow the recovery process. It's important that patients with eating disorders learn ways to cope with their stress and anxiety, and patients that learn to cope with their stress and anxiety have a better chance at recovery. So some signs and symptoms of anorexia are listed here, and then signs and symptoms of bulimia are also listed. Make sure that you know the differences with those. Anorexia nervosa is an eating disorder that causes a person to refuse to maintain a normal weight for their age and height. Thoughts and behaviors include terror of gaining weight, preoccupation with thoughts of food, and they view themselves as fat. So some other things that are seen are peculiar handling of food, like they take small bites, they keep pushing their food around on their plate, possible development of a rigorous exercise regimen, possible self-induced vomiting and laxative or diuretic use, and impaired cognition with judging self-worth by their body weight. Some distortions are overgeneralizing. A single event affects unrelated situations, like I didn't get the job because I'm fat. All or nothing thinking is reasoning is absolute and extreme. It can only be black or white, good or bad. Like, if one laxative works, I should take 10. Catastrophizing, the consequences of an event are magnified. Like, when he says I look healthier, he thinks I am still fat. Personalization is when events are overinterpreted as having personal significance, like he's talking to her because I am fat and unattractive. And then emotional reasoning, subjective emotions determine reality, like when I am thin, I feel in control. Imbalanced nutrition is the most appropriate nursing diagnosis for anorexia. It leads to decreased cardiac output, risk for injury, risk for imbalanced fluid volume. Other things are anxiety, chronic low self-esteem, disturbed body image, deficient knowledge, ineffective coping, powerlessness, and hopelessness. Those are all nursing diagnoses that you may see with anorexia. Bulimia nervosa consists of regularly self-induced vomiting, misuse of laxatives, diuretics, or enemas, and or using excessive exercise to reduce your weight gain. Other thoughts and behaviors associated with it is usually a history of anorexia nervosa. Depression, issues with interpersonal relationships, self-concepts, or impulsive behaviors, increased anxiety and compulsivity, possible chemical dependency, and possible impulsive stealing. Nursing diagnosis for bulimia nervosa, risk for injury is the most appropriate one, but this also leads to decreased cardiac output, powerlessness, chronic low self-esteem, anxiety, and ineffective coping. There's also something known as bigorexia. This is a disorder where an individual becomes obsessed with their physical appearance and develops a disturbed body image. So no matter how finely tuned their physique is, they feel insecure about their bodies and shy away from showing them to anyone. Signs and symptoms of this are obsession with their appearance and working out. They see a distorted image in the mirror. Perception is that they are weak and frail. It's kind of a similar concept to anorexia. And they ingest a lot of supplements. Their diet is probably high in protein. Some complications with this is they will exercise through pain and injury and have been known to exercise even while having broken bones. They will also miss family events and lose their job instead of interrupting their training. An average weightlifter thinks about their physical appearance around 40 minutes a day. People with bigorexia will spend up to 5 hours a day thinking about their body and how to improve it. Approximately 10% of the men who are obsessive gym goers have this disorder. So treatment for eating disorders most often involves a combination of psychotherapy, medications, nutrition counseling, group and or family therapy, and hospitalization. Psychotherapy is used to change the patient's behaviors and the way they view food and themselves. Medications such as antidepressants may be used to help control anxiety and depression associated with the eating disorder. Nutrition counseling is used to teach a healthy approach to food and weight, to help restore normal eating patterns, and to teach the importance of nutrition and a balanced diet. Family and group therapy is used to help the family members understand the eating disorder and recognize its signs and symptoms. It's very important that the family is supportive and involved. People with eating disorders might benefit from group therapy where they can find support and openly discuss their feelings and concerns with others who share common experiences and problems. Hospitalization may be needed to treat severe weight loss that has resulted in malnutrition and other serious mental or physical health complications like heart disorders, serious depression, and risk of suicide. Medications for depression can be used, such as tricyclics and SSRIs. Supplements can be used for medical issues such as hypokalemia, anemia, and constipation. Group therapy is always part of inpatient and outpatient treatment. Being with other individuals with similar problems provides safety for dealing with issues. Sorry, let me catch up here. So some nursing interventions are listed here, and you can just read them on your own. Definitely effective communication is necessary. Active listening by giving the patient your undivided attention is important. You're telling them that they're not alone and what they say matters to you. Clarifying techniques like paraphrasing, which is restating in different words. Restating is your observation of what the patient said. Restating is mirroring the patient's statement. Reflecting is your observation of what the patient said. And exploring is asking questions to further explore a statement. Use open-ended questions. They encourage lengthy responses instead of just yes or no answers. As an example, you can say, "Tell me more about your family." Excuse me. So education will include meal planning, relaxation techniques, healthy diet and exercise, and coping skills. And once therapeutic goals are reached, the patient will need long-term care to maintain their health. The prognosis for bulimia, it's easier to treat with a better prognosis. There's lower mortality rate, and treating underlying depression certainly helps. With anorexia, it's a guarded prognosis. The earlier the interventions, the better the prognosis becomes. And half of the deaths are from starvation, another half are from suicide. So what's required definitely is patience and tolerance. Eating disorders involve a lifelong struggle for the victims. Nursing care has to focus on safety because eating disorders are killers.